Welcome to Central Georgia Focus. I'm your host, Frederick Price. In case you didn't know, May is Mental Health Awareness Month. Did you know that some people also recognize May 12th through the 18th as Mental Health Awareness Week? Today, we want to help keep you with a healthy focus on your mental health and the mental health of your family and friends around you. So we have two special guests, two healthcare professionals, Brenda Griffin, psychiatric mental health nurse practitioner with Piedmont Macon, and registered nurse Linda Lucas, who owns and operates Abundant Care Services. Thank you both for joining us. Got an easy question for you because this is very important. How is our mental health today?
Doing very well today.
Yeah?
Great.
Great. Had a good Mother's Day too, I imagine.
Awesome.
I also saw your nice little watch that your kids got you. I want you to both start by telling me a little about your background. I'll start with you too, because you have an extensive background.
Sure. I'm a psychiatric mental health nurse practitioner. Currently work for Piedmont, been there almost 10 years, mainly in the inpatient unit. We have an inpatient behavioral health unit there, and psychiatric mental health consults throughout the system. I was a nurse for many years prior to that, but mental health is my specialty now, and I love it, love what I do.
What about you, Miss Linda?
I'm Linda Lucas, business owner. I've been a registered nurse for 48 years, a variety of areas that I've worked. Presently, I'm the owner of Abundant Care Services, and we provide services to Medicaid clients and the veterans.
Okay.
In-home care, we send nursing assistants into the home to care for the elderly at home.
Okay. Some staggering numbers that I have for you, a staggering number I should say. 1,600 deaths by suicide occurred in Georgia last year. What are your thoughts on this? I mean, that's kind of a scary number, wouldn't you say?
Very scary.
Yeah.
And it's gone up since COVID. And people need to know how to help other people, reach out to other people when they notice. Sometimes people are hesitant to interfere or to ask. They don't quite know what to say. But just bringing up the topic to open that door for conversation, and being able to recognize, what's going on with yourself to seek out help is important.
And a lot of people don't know, like you mentioned, they don't know how to address situations like this or what to look for. When you talk about the different types of disorders, maybe both of you could chime in on this. What do those disorders look like? I mean, how do you recognize the signs that, someone may be in mental distress?
A lot of times it's with those little subtle signs. They speak when they're not even speaking, especially with teenagers, especially with social media being at the height that it is now, social media and the bullying and so forth. We just need to chime in on the conversation that we're having with them, changing behaviors when they come home, where they were talking at one time, now they are not talking. Just overall, just covering them with communication, because communication is so important.
Right.
Just keep the lines of communication open with your teenager or high schoolers and so forth.
And Brenda, you see this day in and day out. I mean, let's talk about disorders.
When you find yourself avoiding people or isolating from your friends or family or from activities that you normally like to do, you just don't have motivation to get things done. Maybe you have change in your sleep patterns. You're either sleeping way too much or you're unable to fall asleep. Fall asleep, stay asleep. Constantly feeling overwhelmed or worried, or even using alcohol or drugs to help you cope with the problem. That's a big red flag that you may have declining mental health. And most definitely if you ever have thoughts of not wanting to be alive anymore, or thoughts of hurting yourself or somebody else, you definitely need to reach out for help.
Ostensibly one of the most common disorders, anxiety. I know so many people that battle it. I battle it myself with a high-stress job like this. Tell us a little bit about that. What does that look like? How does one address that within themselves and perhaps maybe even a family member or friend that may have anxiety?
Yeah, well, anxiety, and people often ask, what is anxiety?
Yes.
It can present different ways. Worrying too much, just worrying, excessively worrying, more than most people worry. panic attacks that either are triggered or can come out of just nowhere. Social anxiety.
That's a big one.
Yeah, that's a big one. People have a hard time just going to the store. Sometimes thoughts that come, that you don't want to come, negative thoughts. Just being able to go to work and go out in public and function without being on edge or restless or.
Yeah. It certainly is like one of the most uncomfortable feelings, when you're out in public and you're uneasy about what's going on. That's something that I typically battle with. But when you talk about anxiety disorders, or let's say someone is perhaps lethargic, they're in bed all the time, clearly there's something that's going on. How do you even address it? Because you hear all the time family members are like, let's say a mom, thinks their child may be in mental distress, but they're like, I don't want to offend them, teenagers, there's a lot going on. What's the first thing that you guys would recommend do?
First thing I would recommend is communication, mainly with that child, and then we will go to the school system. Sometimes the counselors are in place, and you can touch bases with the teacher and see if there has been any change in that child's behavior at school. We have to pull the educational line or the educational system into creating a total picture of what's going on with the child. But it's communication, mainly communication to me more than anything. And then there are so many different programs out there to help with that anxiety. In the school system, the church family, even extended family members like grandmothers and aunts and uncles. It's the whole community that we have to serve for that child. And it's not hard to do. It's just mainly just keying in and being conscious of his behavior has changed. Her behavior has changed. She was full of life one day, and the next day, she's not full of life.
Yeah.
She had joy, and then the joy was taken. So you have to do a paper trail and see what has changed to cause this behavior, because everything has a root cause of it.
Sure.
And everything has a beginning, and we have to go back and surface what happened. Then we'll be able to assess, and then we'll be able to implement and bring about some changes where it will not lead to suicide.
Yeah. And that's if the person is fortunate enough to get the help, that somebody
have that
sees
help.
that they're in distress.
Exactly.
But what is unchecked stress? What does that do to the body physically?
Stress. Stress it's just a natural response to a threat or a challenge. That's what stress is. And our body, we respond in acute stress. Acute stress, it's flight or fight,
Sure.
flight or flight. And that's acute. And it's like, getting here with the traffic. It's like being here on the set. It's acute, but chronic stress. It can be like with long-term illnesses, financial distress, loss and grief. And it manifests itself throughout all of our systems. It's manifested. We have about 11 different systems, but 5 basic ones. And stress, it manifests. It's pretty much the elephant in the room.
Yeah.
That's what stress is. And it's a very large elephant too.
Yeah.
But it
can cause headaches,
chronic, cardiovascular,
stomach problems.
Yes.
Either
Yes.
diarrhea, constipation, muscle tension, irritability.
Exactly.
That's a big one.
Yeah.
Yes. In all of the systems, that's the thing. The 5 basics, like with the heart, increased blood pressure, increased sugar level, and all of these can lead to heart disease, heart attack, and strokes. That's just with the cardiovascular system.
Yeah, just an amalgamation of things. We need to take a break. We're going to continue our conversation when we return. We're going to talk about how a healthy lifestyle can help you maintain good mental health. Stay with us. We're back in just a moment. Welcome back to Central Georgia Focus. So we are continuing our conversation on mental health. So Linda, you're a nurse, obviously. You've put together this healthy lifestyle plan. Tell us a little bit about that.
Well, it's very short and it's very basic. You know, everything is about basics and it's the root cause. It's the staples of life that will create a healthy lifestyle, and it's foundational. And the first one is water. It's water. You know, water is 95% of our bodies.
Certainly.
And it's very essential. It's a staple. You know what a staple is? It's a foundation. And we can look at our body just like a garden, just like a garden. And how well we water that garden is how well that garden is going to grow, whatever you seed it there. And so we want good health to grow.
Right.
And drinking water is the first staple. As far as how much water, you know, is questionable. But you want all your organs to stay hydrated, and they will function to their highest capacity being hydrated. And one thing, they say half of your body weight in ounces. And as far as drinking that water, it can kind of be a little tricky. You'll think that you have had enough water, but it's very easy to be dehydrated. We had an incident with that with a family member recently, where, you know, we thought we was drinking ample amount of water, and it wasn't. And so one way that you can be assured is what I do now is I have a little about this large, and I fill it up every morning. And the evening, at night, if I'm not finished, I know that I didn't do the amount that I should have.
Gotcha.
But and some people will say, what kind of water? You want to keep your body hydrated, but you also want to keep with alkaline water. And that's questionable with a lot of research and so forth. But reason being, you want your body to be alkaline.
So it sounds like the key to good mental health, water among other things.
Of course, water, that's the main
thing. Stay hydrated.
Hydrated.
With alkaline water too.
Alkaline water. And go ahead.
No, I was going to ask Brenda, I mean, you tell us a little about your day-to-day. You deal with people with heavy crisis is what you were telling me?
So I work on our inpatient behavioral health unit. People are inpatient, they're usually in active crisis, either not able to function day to day, severely depressed, struggling with anxiety to where they can't function. And sometimes when your anxiety gets too high, people start having thoughts of not wanting to be here anymore. We take care of people who are struggling with schizophrenia, actively hearing voices or not being able to think clearly, or even people in active addiction who are trying to come off alcohol, street drugs. So that I'm helping those people on a day-to-day basis.
And let's, if you will, get a little bit more into, I guess, the treatment plan. I mean, obviously medication does help, but what do those exercises do? Let's say you have a patient that, you know, is battling a mental health crisis. They come to you, they clearly need help. From start to finish, what are you doing to ensure that they walk out of those hospital doors?
Okay. So you want to get a background on everybody, going way back. You know, what could have been leading up to this crisis moment. You want to get a thorough understanding of all of that, of all their stressors, of what they've been dealing with, and then of course all of their symptoms, to be able to accurately see, you know, how best to treat people. Not everybody needs medicine. Yeah. Medicine does definitely help. Therapy is awesome. Just being able to be heard and have guidance on some of, you know, the struggles that you're having. Learning coping skills to be able to deal with your stress. Medicine and therapy, they say, help together, help the most. You know, connecting with other people, just being in a group of other people who are struggling like you, people learn a lot that way, and very therapeutic.
It's a way of connecting with people when you're in a group. I mean, it's almost like a safe space. Linda, I want to ask you the importance of sleep too, because I mean, for a lot of people that go through these mental health crises, some people are staying up 24, 48 hours. Just talk about the importance of why sleep is.
Very important. During the stages of sleep, that's when your body heals itself. Especially during, I know some people work night shifts or whatever, but between the hours of 10 and 2, that's when our body releases a hormone that causes healing to come forth. And it's like a sweep when you sleep. And restore those cells, because even with the cells that's damaged, all cancer is just good cells that went bad. And so they went bad because of lack of water, stress, lack of sleep, and lack of exercise. So if you do the water, you do the exercise, and you do the sleep. Sleep is very important for you to be able to maintain your quality of life.
Yeah.
And so during that time of sleep, that's when your body just restores cells.
And that hormone that you mentioned, do you know what is that hormone?
It's endorphin, it's several, but the main one that I'm thinking is the same one that you do when you exercise. Your body releases. It's so amazing how we were made. Even when they sleep, that endorphin that's being released between that time of 10 and 2 to restore those cells, to repair the cells so you can get ready for the next day and the challenges of the next day.
That restoration of the cells, how does that benefit one's mental health?
Oh, your cells, it benefits it greatly. The powerhouse, the cells.
Yeah.
And one thing about the cells, it's amazing. Within 7 years, you can have a whole new body by restoration of the cells. Like like we have 170 billion brain cells. And it's questionable, and it's been researched that a lot of those can be restored and repaired. And so with the proper things, sleep, exercise, and water, that will repair. But even your gut cells, they can be repaired within 3 to 5 days, gut cells. So all of these cells, they can be repaired and renewed if we provide them with the proper nutrients, the proper sleep, and exercise. All of it just works together.
Okay. Brenda, if,
for health.
For example, someone is witnessing someone else in a mental health crisis, what is the first thing that they should do? Do they approach them? Do they call 911? What is your suggestion?
Well, if there's a question of safety, immediate safety, if they feel like someone is potentially, about to harm themselves or somebody else, always call for immediate help, 911. There's also a 988 number. It's a national suicide and crisis hotline number, free, staff 24/7, that can give people guidance. So, if there's an immediate safety concern, always reach out for immediate help. Like we said, just talking to that person, talking to family, trying to encourage them to get help. People can get help through their primary care provider, pediatrician, counselor at school we talked about. There's local support groups that can help people. Very, very helpful support groups for emotional support, strengthening your coping skills, allowing people to feel less isolated. At Piedmont, we have a grief support group and a caregiver support group, free to everybody, and those are awesome to help people through those times. So just reaching out, starting a conversation, calling for help if you feel like there's an immediate danger to somebody's safety.
That conversation is something small that could certainly make a big difference. We're going to take a quick break. We're back in just a moment to continue our conversation about mental health. Welcome back to Central Georgia Focus. So we are talking about mental health awareness, being aware of our own mental health and the mental health of those around us. So let's talk about resources on your screen right now. There are so many across Central Georgia. One of the most important numbers to know is the 988 Suicide and Crisis Lifeline. If you or someone you know may be in distress, may be at risk of suicide, experiencing a mental health crisis, even related to substance abuse or developmental disabilities, the number on your screen is the one to call or text 988. It certainly can save a life. You can also visit 988ga.org for a list of resources. There are a number of local resources, and to get a list of those in our area, you can go to our website, 13wmaz.com. So I just want to end on any tidbit of information that you all may have. I mean, Brenda, obviously mental health awareness, we recognize it in May. Clearly this is a year-long
Definitely. Yeah.
awareness.
There is no health without mental health.
Right.
So we must focus on taking care of ourselves, recognizing, red flags, recognizing signs in ourselves and in others, knowing that there is a lot of options out there, a lot of different avenues to reach out for help, but you got to take that first step to be intentional, to heal yourself and to find help for healing. So you can be your best self.
And that's the most important too. You also mentioned something in the last block about grief counseling at Piedmont Macon. Tell me a little bit more about that, and if someone were to be interested in doing that, because you said it's free, what kind of help would they receive? What would they be doing?
Yeah, so it is, I believe it meets weekly and monthly. Franchetta, she's the therapist that's been doing this a long time. She's wonderful. She's amazing. And so anybody that's struggling with the loss of anyone can go to this support group, and it's not one-on-one. You're in a group with others, but very, very healing, very therapeutic to heal from that.
Yeah, with a group of
Pain.
people, which
Yeah.
is also very important. Linda, I want to end on you because we got just a few seconds left.
Okay.
What information would you like to add about
As
mental
far
health?
as getting to that place, as far as being affected by the mental health, we can go preventive, and the preventive way is with water, exercise, and sleep, and being intentional with your water intake, your exercise at least 30 minutes a day, and sleeping 6 to 8 hours. John F. Kennedy said, time to repair the roof is when the sun is shining. And sometimes we don't get a chance to repair that roof when the sun is shining. And we're at a place where we have to repair the roof when it's raining. And so that being said, what we really need to do is just do the water, exercise, and sleep. And as far as the food that's included, stay away from the sugars. What the sugars does, it destroys the vessels, your blood vessel. And as far as they said, now it's the new Alzheimer's.
Oh, really?
With the increase of sugar. And it's many variables that we can avoid getting to the place of the mental health.
Okay.
With the water, exercise, and sleep.
Water,
And exercise and sleep.
water, exercise, sleep. Those are the three key takeaways.
Foundational.
For sure. The foundations. I do appreciate you ladies so much for talking
Thank you
about
for
this.
having us.
It's very important, not just for the month of May, but clearly year-round. That does it for us for this edition of Central Georgia Focus. I'm Frederick Price. Thank you so much for being here, and we will see you next time. Have a good one, everybody.